Hey, good morning. Welcome to what I believe is our 48th partner forum. And I always begin the same way by saying that whether you have been to every one of those 48 or this is your very first time, we are so happy to have you. We appreciate you taking time to do this. We also want to give our appreciation to Aetna Healthcare. They are the folks who make these virtual forums possible, and without their help, we would not be having them. So we appreciate that. As you know, today is almost the end of a really important month each year, April, where we focus on preventing child maltreatment. And we wanted to culminate today with conversations with sort of the two most senior people in the Commonwealth who are responsible for that. And so we'd like to initially invite you to listen to Governor Beshear talk about this. You all know that Governor Beshear, as Attorney General, made battling child maltreatment one of his cornerstones. I think it is very fair to say that that has continued as governor. Afterward, we're delighted to be joined by Secretary Eric Friedlander, and Eric and I are going to then spend most of our time together talking about where this sits in Kentucky. Finally, we're going to culminate today, and in some ways the month, with Keith Inman, President and CEO of Kosair Charities. Most of you know that the seminal effort, non-governmental effort in Kentucky is Face It, a movement to end child abuse. That is led by and possible through the good work of Kosair Charities. So with that, I'd like you to sit back and join Eric and myself in listening to some words from Governor Andy Beshear.
Hey everyone, it's Andy. As April comes to an end and we close Child Abuse Prevention Month here in the Commonwealth, we must commit to continuing the important work of protecting our children. I know the work being done by you at the Kentucky Youth Advocates is making a difference. We here at Team Kentucky will always support you, as there is no greater priority for me as governor than ensuring the safety and the health of our children, both physically and mentally. This is a critical moment in our fight against child abuse. Since 2017, Kentucky has had the highest rate of child abuse in the nation, more than twice the national average. And the COVID-19 pandemic has only exacerbated these challenges. It is unacceptable. Since my time as Kentucky's Attorney General, I have prioritized protecting the children of Kentucky from predators, from abuse, and from exploitation. And that work continues today. During this past year, we've worked to meet the needs of Kentucky's children as we face this global pandemic. We administered PEBT benefits to more than 640,000 students, providing meals to children who depend on school meals for daily nutrition. At the same time, we administered SNAP benefits to an average of 100,000 more individuals each month when compared to the previous year. SNAP is the first line of defense in Kentucky, as nearly 70% of SNAP participants in the Commonwealth are families with children. We prioritize the health of our kids by expanding Medicaid and K-CHIP programs. We distributed over 250,000 masks as part of First Lady Brittany Beshear's Covering for Kids campaign. And I outlined in my Better Kentucky budget how I am committed to increasing funding for the Department for Community-Based Services so they can hire an additional 350 social workers and other support positions. So as you continue to fight, and as you work to create and implement more programs to help our kids, know that you have the full support of Team Kentucky. I've always said there is strength in a unified team, and this group, we are united to help better the lives of the most important among us, our children. Thank you for dedicating your time and your efforts to this work. I know it isn't easy, but you are the true heroes making a difference in the lives of our children. Remember, we'll get through this. We'll get through this together. Let's build a better world together, especially for our kids. Thanks.
Great. Well, welcome back. And Mr. Secretary, thanks so much for joining us today.
Absolutely.
Yeah, before we get into the topic at hand, it should not be lost on our viewers who typically see me in my home office that I'm not in my home office, but we're sitting pretty close to one another. I'm pretty excited. You probably cannot see it, but I've got this very special sticker on my lapel, as does the secretary. And it not just says Kentucky, Team Kentucky, but it says Shot of Hope. That means that I have been fully vaccinated, and so has this gentleman. And that's the reason we can do that. I wonder, Mr. Secretary, if you want to take just a minute and talk to folks about the power of Kentuckians getting vaccinated for all of our sake.
Yeah. Thank you, Terry. I do appreciate it. And yes, we did this to demonstrate that there really are benefits to getting vaccinated, and we can actually sit face to face. It's been a long time.
Right.
And I just want to celebrate the miracle of science, that we have vaccines that are incredibly safe, incredibly effective. You can see that in the impact we're having in long-term care.
Yeah.
These are vaccines that when you look at polio, right?
Yeah.
Actually,
Kosair Charities.
Kosair Charities,
such a
right?
key role.
Exactly.
In polio, yeah.
So waited 35 years for a vaccine. This is less than a year. And if you try to compare the two, this is far more lethal and far more contagious. And so getting these vaccines, making a difference for all our communities to be able to get back, I think, as you said, to a new normal, to a better normal, right? And I think that we learn from what we go through, but we really need to work together, because there are vaccines. You can walk up to a Walgreens, to most Kroger's, to most Walmarts, to most CVS, right? You can walk up today and you can, in all likelihood, get a vaccine. There is enough supply that we can all get vaccinated. So I want to encourage everybody who's watching this, childcare providers, those folks in child caring facilities, get vaccinated. It will make a difference. We're able to do this because of that. You know, if our families were fully vaccinated, we could all have them sitting in this room.
Absolutely. Absolutely.
We might be having more fun.
Yeah.
But this is a way for us to do this.
Yeah.
So please, I talk about we lead from every seat. Lead from every seat, and make sure that you're telling folks it's important to get vaccinated. Thank you for allowing me to do that small commercial.
Well, and I will tell you, our partners, that the Secretary is being very gracious. I can be a little less gracious, and I want to give you a historical metaphor. He mentioned the power of that polio vaccine that, frankly, Kosair Charities cut their teeth on in the early 50s. Fascinating thing was that Jonas Salk got in trouble because the grant he was working on at the University of Pittsburgh was to think about ways that children could deal with polio, having polio. He was not funded to eliminate polio, and actually got in trouble. It's like, we didn't fund you to solve it. We wanted you to work on, handling it. In a lot of ways, my fellow Kentuckians, you kind of are in one of two camps. You either want to continue to think about how we mitigate COVID, or you want to solve it. And Mr. Secretary, I may be wrong, but what I'm hearing is that if we get to that 2.5 million threshold, life is going to get better for everybody.
Yes.
And so, I would just echo the Secretary's sentiments. I really want to say, don't be selfish. So maybe I'll say, don't be selfish. Get vaccinated, join all of us so that we can mitigate those impacts, and let's us be the Jonas Salks of this generation. Mm-hmm. So we're with you and the governor, and we appreciate the leadership that you and he and Dr. Stack are given in this such an important public health campaign.
Oh, thank you.
So we're going to shift to the topic at hand. And I'm going to do something that those of you, including my colleagues who know a lot more about media than I do, they're going to say that was a terrible idea because you're not supposed to have dead air. But, you know, I worry a little bit that it is so easy to say April is Child Abuse Prevention Month. Then the secretary and I are going to get into data and numbers and policy. And at the end of this conversation, you're going to leave perhaps with more information, but I want to engage your heart and your soul, not just your head. So I'm going to invite you to think with me for just a few moments. And I don't want you to think about this issue globally. I don't want you to even think about Kentucky's kids collectively. I want you to get an individual young person's picture in your brain. Maybe that's a son, a daughter, a grandkid, a nephew, a niece, a neighbor's child, somebody you go to church with, a colleague's child. I want you to get an individual kid in your head. And I want us all together to take just a few seconds and think about what it would mean if that little boy or that little girl was being abused. So I'm going to ask you to just settle in, maybe close your eyes for just 30 seconds and try to think about that mental image. I appreciate you you doing that with me. Mr. Secretary, I naturally thought about one of our grandkids. Mm-hmm. And when I think about if that would have ever happened to one of them, I would be outraged, I would be enraged, but I hope I would also be emboldened to know that I've got to take action individually for them. But what we're talking about today is how do we take action for all those kids in Kentucky? Right. How do we take action for the more than 20,000 children who got abused in the last 12 months? So I'd like to give you a little margin at the open just to riff. Our good friend Keith Inman, who is going to join us later, mm-hmm. always talks about what we need is a COVID-style offense. You think about the intensity, those every day at 4 o'clock press conferences. What would it look like if we did a full court press on abuse and neglect in the Commonwealth?
Thank you. What I want to say is, I think the full court press is what we're doing. Okay. It's the collaboration among the folks that have been collaborating and still need to collaborate, right? It's the private sector, it's healthcare, it's judicial system, it's the education system, it's DCBS, it's all our providers. It's that kind of collaboration that needs to occur. But since you give me a second to riff, sure. I want to let folks know like what the direction is of the cabinet, right? And you know, certainly Dr. Stack is fantastic in terms of helping us with our response on the public health crisis. Commissioner Marta Miranda Straub, I think, is one of the leaders in Kentucky on thinking about how we do this full court press and do things differently, particularly within the cabinet. The charge there is this: this cabinet needs to be about supporting all people, including children, to live to their full human potential. Now, you have trouble doing that when you're being abused or you're being neglected. And you have trouble doing that when we know what our poverty rate in the state is. You have trouble doing that when you look across and see the challenges on equity and trauma Do you have trouble doing that when you know that we have so much disparate and negative outcomes in terms of health across the entire population? All of those things flow in together. So we're about making sure that children live to their full human potential. We're about making sure that we do that in an equitable manner. It is one of our pillars, right? It is a lead pillar for us. Now we're looking at race, but we're looking at equity across the board. We're looking at what we call resilience. Some of you all may know I was chief resilience officer for the city, but also when you do a pillar, right, it needs to be positive. So resilience is that response to trauma. That how do you come back?
Affirmative reaction.
That's the affirmative reaction to trauma. So we're really looking at not only talking about trauma informed, but looking at our workforce. What's that secondary trauma do to the folks who are out there trying to provide services in the field? How do we address that? So again, I think we have some really strong partners in that, and internal partners and internal experts. Then we have to look at what are we doing that is the economic support that this cabinet gives across the Commonwealth. That includes K-CHIP, that includes Medicaid. The governor talked about SNAP and PEBT. And so it's not only what that does for families, but it's what it does for our communities and supporting folks like grocers and medical providers, right, who should be partners with us. And then finally, what is that health and wellness? How do we have an impact and move the needle on that? Because so many of these things are intertwined in what then comes out as abuse and neglect for children. So how do we support everyone to get to the point where we have minimized what we want to see or we want to get away from any abuse or neglect in our communities? We have to bring all those forces together. We have to act in concert with a clear vision in mind to have the impact in the communities that we want to have and for children.
I want to follow up because you said something really important about how all those things were connected. And I know that is one of Commissioner Straub's big drum beats. I did not see everybody, folks who was on who were on the screen before we went live stream. I did see my good friend and colleague Pam Darnell, who exemplifies this as well at Family and Children's Place. We know that I'm not supposed to say causal factors. I think I'm supposed to say correlated factors. So we know that when you look at those more than 20,000 kids, economic insecurity was there in 77% of the cases.
Huge.
Opioid problems.
Yes.
Family stability. We know there's a myriad of connected issues. And I do think folks know on screen, you know personally, that I've seen a whole lot of people sit behind this desk, and I do not hesitate to say that you absolutely are the best thinker about complex things that I've ever seen sitting behind there. So I'm wondering what your gut tells you. We know that the initial reports, in the middle of the pandemic was child abuse reports were down. Nobody believed that. We knew that the reporting sources were closed. But that interconnection of food insecurity, housing insecurity, economic stress, apparently increase in addiction rates. Which I guess your fear, maybe not your gut, but what do you think the real state of maltreatment in Kentucky is? That's a tough question. It's a hard thing to talk about.
It is a tough question. I think all the other indicators, substance use overdose, what we know is some additional economic insecurity, even with everything we've been trying to push out, and we have been aggressive about that. My fear is, and I think we're starting to see a signal, right, in the data. I look every day at our call volumes and where we are. We are seeing an increase in the call volumes on the CPS line, right?
Which is actually encouraging.
Yes.
In some ways.
In some, yes. But that is a signal, right? That's an initial signal.
Canary in the coal mine.
Yes. So we're starting to see some of that increase as schools come back in, as reporting sources. childcare, pediatricians, churches, schools. That's where and we really didn't see the signal loss from the pediatricians. We really didn't see some of that signal loss. We saw the signal loss from schools, right? And that's the most important reporting source for us. So we're just beginning to see that increase. Like I say, I'll watch every day. And so I think you start to see that happening. And I think we will see that. I hate to say it, but I think we will see that. But that's why it's incumbent upon us, right, to make sure that those supports that we can give are going to be available to our communities. So I want folks who are listening to this, if you know of families that are in need of assistance, I think the biggest philosophical change that we may have had recently is that the belief here, and that I have, is that you get people to self-sufficiency through support. You get people there through providing services and support so that they can look for that living wage job. They can be healthy enough to get that living wage job. They can have enough nutrition to be able to provide the good interview to have that living wage job and not be worried about everything that's happening to them to get them to a better place. So that's the push we're going through now. We're trying to give as many of our partners as deep into our systems as we can. And that's true about all our services. And we're continuing to develop and roll that out. But my gut is, right, we've gone through this time of great collective trauma, right? And what we know about that is it's not during the trauma event itself, it is that 6 months to a year later. So we're going to have to double down on our behavioral health services. We're going to have to double down on our substance use services. In Medicaid, we're not putting prior authorizations back in those areas because we know we need to provide as many services, as many coordinated services as we possibly can.
Let me ask you, I want to follow up because you said if somebody knows a family who needs something, actualize that. I'm not running a large nonprofit because I probably know how to get to you if I'm on the screen there. But I'm just a interested citizen on this call, and I know somebody in church, somebody down the street who needs something. What advice do you give them in terms of actually getting results? Who do they call? They work a local community deal, call somebody at the cabinet. What do I do if I feel that call, if I feel that need?
What I hope folks do is, I hope you all have seen this at this point, we brought back Connect. Right, but Connect is much more expanded than what it was. Right, we have those of you who may have been familiar with Benefine. Right, that's all under Connect now. We have a resources page where we've partnered with United Way, right, and 211. So that continuously feeds that Connect resources, and then we have the health benefits side of it. So my suggestion is, please help somebody get to Connect. There's a self-service portal in our benefits piece that can help people get through that. A lot of our system, right, for healthcare, for SNAP, for childcare, and TANF, and we're redoing a lot of work, and particularly TANF, that we're going to try to expand and modernize those services, as well as then the resources page. So you can help somebody look for local resources. And if you want to sit with them as a concerned individual, you can get through a lot on our website. And so I hope people use it. And then if folks use it and they say, well, that didn't work so well, or that did, let us know. Okay. Right. And there's a number to call. You can call, but then you can certainly email us, the commissioner, whomever, and say, hey, this would have worked better if you'd done it this way. And we are always open to those kinds of suggestions on a policy level, as you know.
Yeah. So I want to just emphasize what the Secretary said, which is if you know that family down the street, don't wait for the tragedy. Go to Connect. With Keith Inman's permission, I'm going to tell you that if you looked at the list of partners on Face It, if you got a little confused as to navigating that site, call one of those partners on Face It, and I'll guarantee you every one of those partners know how to navigate it, and they will be responsive. So grab that individual action. You know, Mr. Secretary, I've told you this more than once. Among the things that I most admire about you is what a great leader you are, and also what a persistent learner you are. I think I remember the very first time, you and I have known each other for a long time, but the very first time we talked about you running this place, you came to our office because you knew I made really good coffee, and we sat and talked, and you, one of the things I remember was, even though you had a lot of experience up here, you were like, I know I've got to learn. I really remember you talking about that. Well, at the time, you did not know, you couldn't even spell COVID, so you didn't know what that was. But I'm just curious from a very broad perspective. I mean, this is like a battleship, and yet you've been turning it in the river a lot. What are 2 or 3 lessons? And I'm really asking selfishly because my guess is some of the things that you've learned navigating this crisis, gradually moving toward that new normal, lots of organizations could learn from. So what are those 2 or 3 things that, you know, Eric Friedlander, the learner, not secretary, is like, man, I ruminate on this when I'm driving back home from Frankfurt?
The first thing is the biggest learning that I've had, and I've been around this cabinet, as I've, you know, for 176 years, and been over a lot of different things here. COVID forced us to be nimble, right? And the cabinet is not known for being
Really?
nimble.
That's
CHFS and nimble are like, they don't go together.
Oxymoron.
But what we're able to do in terms of folks working from home, right? Really pivoting how we work, setting up whole systems in public health, systems of testing, systems of reporting.
We've never even conceived
that
of.
we've never conceived of. And all of that, how we have then had to say, oh, you know, with the PA and the prior authorization, and telehealth and all these things that we've had to roll out PEBT in a flash, right? We are not known for doing anything in a flash, right? It's more we measure our change in geologic age. But we had to do it. Well, the huge learning that I've had is that we can. And there is no reason to say, you know, sometimes there's, but there's no reason to say, well, we can't do it quickly. We can't change and respond to our environment with far more speed than we ever thought possible. So that's a giant learning for this cabinet. And the corollary to that is this. Not only have I learned that we can do that, but then what does it look like moving forward with that knowledge, right? I don't intend to come back in the way that we were. My intention is that we're going to be very different. We actually have found in the cabinet that we work better remotely, right? That we're actually more efficient. Early on, somebody said to me, well, how do you know folks are going to be productive? And I said, well, how did you know somebody was productive when they were sitting next to you, right? So we need to learn from that, right? We'll make mistakes. The best thing I learned from like working at local government is that it's okay to make a mistake as long as you learn from it. And that's what I've tried to say to everybody here. Let's try something. We can make a mistake and learn. And because I now know that we can shift quickly, we can learn from it and come back better. Not catastrophic. And so we're not going to come back in the way that we were. We've learned how to work together across departments in ways that we didn't think possible before. And so we need to continue with that learning, right? And come back very differently. Come back in a way that is supportive from a trauma perspective, right? That is supportive from an equity perspective, that forces us to work together in ways that then we need to be putting the needs of the folks that we're serving first. I know that that's easy thing to say, and I've been around a lot of different organizations, but that is hard to get accomplished.
Client-centric orientation,
Right,
is a tough thing to actualize.
and when you think about COVID, we've all had to do that.
Yeah.
Right. How do I not spread a disease to somebody I'm trying to serve? Right.
Yeah.
That means you're thinking about them first.
Mm-hmm.
So I think that's a giant learning from a lot of different organizations' perspective. And I say this a lot, so some people have already heard me say this, and I'll apologize. The other giant learning that I hope we get out of COVID is that whatever happens to any one of us in our communities, homeless person, right? Somebody with substance use disorder, a neglected child, right? Impacts us all. And there is nothing that shows that more than a virus, right?
Mm-hmm.
And if we learn to put that person first, and what's the impact of that trauma on that person? How is that going to impact a broader community? We've now had that demonstrated for us.
Mm-hmm.
Let's learn from that.
Mm-hmm. That's great. That's great. I want to move to policy in a minute, but you said something that is very important. You brought up resiliency. I know that's one of your jams. We at KYA increasingly see resiliency as just a critical commitment in every sector of work that we do, because kids, we know, don't grow up in silos.
Right.
And it's not enough to identify deficits. We've got to identify assets. And so I liked your analogy that resilience was the positive, proactive response to bad things that happen for kids. Again, like I know when you love when I say riff, because you're really good at it, but for folks, a lot of folks who are joining us today know a lot about resilience. There are other folks who probably are a little bit now, what the heck is he talking about? So could you give us just a couple minute, Reader's Digest? What does when Eric Friedlander thinks about resilience at a family or a community or a state level, what are some images? What are some ideas that come to your mind?
So I think I mentioned I was the chief resilience officer for the city of Louisville.
Right.
So I had to get a little in depth. It was something that was funded by the Rockefeller Foundation, which was lovely. They paid my salary for a couple of years. That's great.
That's good.
Got to travel.
Yeah.
So resilience. The easiest way to think about it is the mechanical resilience, right? It's how something springs back. That's an easy way to think about it from some sort of stress. The other way to think about it is this, and the broader way that we were trying to think about it in Louisville was something's going to happen. It's going to be acute, like a flood or tornado, or it's going to be chronic, like what we see in Kentucky when we talk about child abuse and neglect, poverty, substance use, right? Something that is just chronic, that stresses the entire system. So how do you respond to that as a community? I was working on the local level at that time, but then you can think about it from a state perspective as well. We've had an acute and chronic piece in COVID, right? It's gone over a long period of time, but it has stressed our systems in ways that no one could have foretold. How we bounce back from that, how we come back from that will be the measure of our resilience, will be the measure of, are we coming back stronger, meaning higher resilience, or are we coming back where we're broken, right, which is no resilience. And my time working in Louisville, we talked about resilience. We as communities, it's like you hear the analogy all the time, we're as strong as our weakest community, right? We'll break, from a resilience perspective, we'll break where our communities are at their weakest. Resilience for the Rockefeller Foundation began really with climate resilience. I was the first person that came from a social service background that was hired into the chief resilience officer role. I think over time that became more normal, but it really, the focus for me was on resilient community, right? Again, those marginalized folks all live on, many live on the edges, right? Around where there's a flood zone, where there may be, when you look at a worldwide perspective, more of a mudslide that might occur, right? In these kind of marginal lands too, which are more impacted by climate change. But you had to get those communities resilient. You had to strengthen those communities so that when the shock came, they could be more resilient. And that's how I think about it. If that's helpful to folks, it is then how do we come back from something that we've just seen?
Yeah, so I love your just spring back. That's such a simple but profound way to look at it. So if you're joining us, you know that we at KYA absolutely want to honor the daily on the ground efforts that so many of you are about. And we know if we're ever going to get ahead of the curve on child maltreatment, we got to have you. We know that what frontline workers at DCBS do every day, absolutely essential. We got to have those folks providing quality interventions. But you also know that our hypothesis is that we've got to get a meta-narrative change. We've got to get policy change. We have to address issues like the state budget. So I want to just do a quick reminder that we've got to already begin thinking about 2022, and that's what I'm going to invite the Secretary to get in with. Those of you who joined us the day after the General Assembly adjourned, you saw Senator Thomas and Senator Westerfield join us about 10 hours after they had left the closing gavel. And what I took away from that conversation was in the 10 hours that elapsed from the closing gavel to the beginning of our forum, Senator Westerfield had already begun filing bills for 2022. So we can't wait until October to think about what the General Assembly, don't want to put pressure on you, but what the governor is going to do with the budget in 2022. My hope, and I know the Secretary is very good at thinking about common ground. I want to offer some hope. What we saw as the key bills around kid maltreatment, I call it the Face It policy package. This last session, the votes on 4 distinct bills were 498 to 12. 498 to 12. That meant that over 98% of the votes cast were on behalf of kids. Secretary can't say that. If you're wondering who in the world voted for perpetrators instead of kids, go to our website, look up the blueprint bills and find out who voted no. But that's a different topic for a different day. So we're going to move into 2022. Mr. Secretary, lots of folks are involved in lots of different policy priorities. Face it, the blueprint. I want to invite you to give us your Christmas list, okay? And I want to start though, because I want to tackle one for you. I want to set you up so you don't have to bring it up. I increasingly have talked about that the 21 session was full of puzzling perplexities. So we saw the General Assembly, I just said, we saw them vote over 98% yes on really tough measures to protect kids. And yet when it came to supporting DCBS's frontline staff, it was like, yeah, we don't think so. So like, that's confusing to me. I want you to help us build that case for that budget ask, because I hope the governor asks again for not just more workers, but quality issues, retention issues. So the workforce issue in the cabinet, I'm sure you're shocked by this, frequently is not a sexy ask. People are like, there are already too many, they're not doing it, et cetera. And yet I think folks on our call today would say, we've got to have a high quality adequately staffed, quality staffed frontline force. So build the case for us so we can lend our voices to your voice on that.
Thank you for that. The first thing I want to say is when I talk to social workers, particularly cabinet social workers, I talk to them about everyday heroes, right? And that's who they are, right? They're going sometimes into places and areas with domestic violence and that are flat out dangerous, that sometimes our law enforcement will go, and able to diffuse situations and really getting into to every day these life and death decisions, these impactful decisions that are going to impact a child and family's life, right? And they're there every day, really showing up, really showing out, and doing what is tremendously difficult work. So the first thing I need to say is thank you to them. The second thing is this, and I don't know if this is building the case or I consider my one skill is my firm grasp of the obvious. We need to support them. We need to support them with training. And I know Commissioner Miranda-Straub is looking at this. We need to support them with training. We need to support them with real world experience. So many times folks come out of an straight academic piece, and then you get into, wait, where am I putting the chair here? How am I positioning my car? Where do I park? Yeah. Those kind of real world issues. How do I, I've got the academic of how I de-escalate, but what does it mean when I'm sitting here with you, right?
Absolutely.
So how do we support that, right? We have to support that in a different way than what we have done, because then that gets to retention, right? So that your folks who are more experienced, who can handle the higher complexity, actually will stay, right? How do we address when you're in there and you see day after day after day after day, folks talk about, again, law enforcement folks who see that all the time and then get their views skewed, perhaps, right? Same thing happens, right? Day after day, you're going into a situation, but by the time you call us, it's usually not good, right? So that you're seeing that day after day. How do we support you to be able to step away from that, so that trauma that you see every day isn't impacting your life, burning you out, and impacting you in ways that affect your family and affect your loved ones, right? We have to support that. We have to support that, or else we end up in this situation where we see high turnover. We're always having somebody new on a case, right? That's as important as hiring more. We need to hire more. But that piece of training and support and how we do that is as critical as getting more.
A lot of ways it's recalibrating the profession.
Yes.
Yeah.
Yeah, and we have to do that in concert with folks like you, in concert with folks like Kosair and other, Casey Foundation and those folks who are supporting some of this work here, which has to be transformative. Yeah. Right. Again, I think I have the right commissioner in the job for that. No pressure, Marta. But I think we do, right? And how we engage community is so very important. So we have to have funding for that. We have to have funding for that. Otherwise, what is that saying? Doing the same thing over and over again and expecting a different result is
insanity.
Yes.
Yep.
Yes. Thank you.
Yes.
So we have to change the way that we do that, and then change the way that we look at neglect, right? What does that mean, right? Because oftentimes we see neglect and we get too confused with poverty, right? And so what is that approach that we need to look at that's a little different, right? And then we need to talk about how we bring more folks into the system so that we know once they come in to our system, they're going to be trained and supported in ways that can keep them healthy, right? And keep their relationships with the folks they're trying to serve healthy, so that we have the maximum impact of addressing that trauma and addressing some of the economic pieces and addressing some of the health and well-being pieces to help them, the families, live to their full human potential, and the folks that work for us.
That's great. I appreciate that. I wanted to just emphasize to all of you joining us, our goal is that by middle of the summer, we've been able to talk to this guy, maybe his boss. We want to be able to talk to Speaker Osborne and President Stivers. We want to be able to begin shaping a bipartisan, common ground, common sense agenda when it comes to child maltreatment. And we need your ideas on that now, not in August, not in November, now. So please use your experience and your commitment and help us figure out what those items are. What I can tell you is that we have found Secretary Friedlander, the commissioner, the governor, and I need to say also Republican leadership in both chambers, very, very open to hearing from all of us. I think maybe the challenge is timing, because again, it is so easy, isn't it, to think that the General Assembly starts in January.
Mm-hmm.
It's already started.
It's already started.
So again, I want to invite all of you to be part of helping us shape that agenda for kids. Mr. Secretary, I want to pay attention to the time up here, but there's no way that I don't want to offer you what I call the benediction. So we could talk about maltreatment forever. I appreciate your reality-based, but your aspirational orientation. So take a couple minutes and close it out for our partners. Give us some Eric Friedlander reflections.
What I want to say, because I've talked about DCBS, and what I want to say to our partners is this. We do hear you. We do want to work with you. We do not exist without you. So don't think for a second that we don't know that we are dependent completely upon your services and your support. We need that. We need to be able to listen and then work together about what is the best interest of the person we're trying to serve. We all begin there. Child caring facilities. We've had this discussion for a long time about, where is the appropriate place? How do we support as much in our communities as we possibly can? And how can you be a part of that? Help us, work with us, find those ways that work, right? For the folks we're all trying to serve together. And again, it has to work for you too. As I was discussing, the importance of making sure that we support the folks who are working for DCBS, right? We have to be able to support the community of practice. And that's what we have together. So working with KYA, right? Working with the General Assembly, acknowledging, where I started in some ways, that we'll all make mistakes, right? We'll all stumble, but if we can support each other in terms of getting up, acknowledging that we all stumble, but acknowledging that we're working on the best interest of kids and families, because I know that's what we wouldn't do this if we didn't have the heart to do this. We would not. And we need to acknowledge that in each other. And if we can do that and support each other as we go through what will be tumultuous times and general assemblies, and if we can do that and do that together, we're going to be in so much better place, not only in ourselves, but for the folks that we serve and for the entire state. And I know that's an aspirational and a big challenge, and that I've heard it before, but it's true. So let's work together.
Thank you so much. One of the real advantages of being vaccinated is that I can use your wardrobe as a way to close it out, because who else can wear, you may not be able to see it, and the Secretary's already said he is not going to show you his ankles, but his socks are filled with mint juleps. And I think that probably reflects a spirit of lightness and joy that you bring. And I think that's really important. But even more profound is your tie, because the secretary is wearing a tie that has a lot of kids, and between each kid is a heart. You have a heart for kids, and that means so much to us. And Mr. Secretary, I just want to say thanks for your leadership.
Thank you.
And thanks for the example you give us all. Okay.
Absolutely. Thank you. Look at what we can do when we're vaccinated.
Absolutely, baby. So you talk about another person who has a lightness of spirit, but a very passionate and persistent heart for kids. That's my friend, Keith Inman. As I mentioned, so much of what's happening around progress when it comes to maltreatment is directly traced to Kosair Charities and the vision and the guts and frankly the resources that they bring to the Face It effort, a movement to end child abuse. So Keith, having the governor and the secretary and you, man, this is a trifecta, baby. We're getting trifectas before Derby Day. So I can't think of a better way to kind of culminate this month than a reflection from you. You know we appreciate everything you do. I know that I was supposed to open with this, so I do need 30 seconds to remind folks that next Wednesday, the focus is going to be on childcare. We are going to feature Dr. Sarah Vanover, who is Eric's point person for childcare. We also are having Senator Julie Rocky Adams and Representative Josie Raymond. So we're going to have Dr. Vanover talk about the state of childcare and where we're going. And then we're going to have Julie and Josie on there to follow up on what we're talking about. We're already going to be pushing them around the 22 session in childcare. So we hope that we'll see all of you next Wednesday at 10 o'clock. Brother Inman, close us out.
Well, I don't know if it's a trifecta, but I certainly agree it's a daily double. So,
Okay.
So you know, there's that. And Mr. Secretary, I certainly appreciate your time today and everybody on this call, because you're an inspiration to Kosair Charities. You're the reason Kosair Charities is involved. And I learned a lot today, and I learned that we all are working together. But if you look across the state, there are literally hundreds of thousands of individuals that need to work together, that have to work together, have to work with your office to end this scourge on our kids. You know, Terry opened up, you know, that my dream is that we have that 4 o'clock time slot after COVID, because you've done a great job bringing focus on something that is just horrible for our communities and our state and our citizens. But in the history of the world, COVID is a short-lived situation. This issue has been along with us, and we just need to take more resources public and more information to let our citizens know where they can get help. Because, you know, let's face it, this is over 400 to 500 people, kids a week. So I applaud your work, Mr. Secretary. Terry, we couldn't do what we do without Kentucky Youth Advocates and everybody on this call. You bring inspiration, drive, and determination to us, and I can't thank you all enough. And I will give the Secretary $2 to bet for me, because I know he's due. He's going to be a winner.
Thank you, Keith. Thank you, Eric. Thank all of our partners for all you do and for taking time today to sort of virtually culminate this important month. Let's make sure that our commitment goes way beyond the end of April, and it's a feature of all we do. So thanks. Hope everybody has a great Derby weekend, and we're going to see you next Wednesday, where we tackle the big issue, very, very related to child maltreatment, of childcare. Thanks so much.